Hi everybody, Dr. Vaughan here, late at the office. This is very unusual for me to stay this late. Let me turn the phone around so I can see you guys and see who's coming on and who's very late at the office. Ask Dr. Vaughan. And boy, everybody's coming in. Jedri, oh yes, Holly, thank you. I'm glad that you're participating. Glad to have you here and glad for the hearts. Gabe, thanks for coming. And hello, AMCCARI or CALI, I can't see that well. Empire City Ray, welcome. Welcome. We're glad to have you here. Danielle, thank you. And let's see, who else? We got Gabe Sanchez and Chief Executive Mind. Hi, thanks for coming. Shannon, okay, let's see. Somebody pronounced your name correctly. Grosskritz. Tell me again if I got it right or not. Yes, hi, Shannon. Glad to have you here. All right, let's see. Holly wants to bring something on. She's freaking out because she coughed and it was crackling and she's terrified her lungs are filled with fluid. Well, let's talk about the situation of people having a crackling sound when they cough. It may just be a little bit of benign fluid. It can be serious fluid. The way you tell is by having a doctor listen to it. There's different sounds to it when they listen from the outside. Grosskreutz. Also, chest x-rays are often used when, depending on what the sounds are, the clinical presentation. No, there's no reason to panic. If you're short of breath, you probably should get checked out. If you're not short of breath and just hear a sound, it can wait. If you're not having a fever and vital signs are normal, of course you have to go get checked to have vital signs checked. So probably not a good thing for us to talk about on Periscope, because what I'm realizing is over Periscope it's absolutely impossible to reassure a person that they don't have something horrible. So that's, I guess, lesson learned. Yeah. So, Holly, I'm going to leave your doctor-patient relationship between you and your doctor and not enter into it. I can talk about general medical topics. And I'm sorry, Holly, we cannot address a question specific to you over Periscope because I'm not your doctor. And that just gets us into places we just cannot go because of the limitations of Periscope and because this is actually for fun, not for actual treatment. So sorry if I cause you any anxiety. And generally what we try to do is direct people towards their doctors. And we have Chief Executive Mind would like to know about keloids and can they be removed and why are they formed? For some reason, when a scar heals, you can have overproduction of the actual tissue that forms when the skin heals to itself, what we call a scar. And we get too much of it, or a hypertrophic scar, we call that a keloid. Some people have it all the time, anytime they get injured. Other people, it happens under certain circumstances. It's worse when there's a lot of sun exposure on a scar. That actually makes it worse. It's worse when there's certain types of tension on a scar as it's healing. They can be removed, although, here's the thing. If you got a keloid from a scar forming and you remove it, does anybody see where this is going? Then you are at risk for having it just come right back with the healing of the scar from the removal of the scar. So oftentimes what they'll do is inject it with cortisone at the time of the revision or the repair, and then you don't get that keloid back. And so a lot of doctors will go ahead and do this. Yes, Shannon Grosskreutz knows that chances are you'll get another scar, but injecting with the cortisone can help with that. But of course you have to be careful with that because that can cause the skin to discolor also. How common is it to get Lyme disease from a tick? I'm trying to remember what the actual statistic is on that, and you may get different statistics on the West Coast and the East Coast because some people say there's actually some slight differences, and it is very rare to get it from a tick. Now, here's something to keep in mind is that the tick population in your area of a particular species of tick, Exodes pacificus out here, Exodes scapularis in other parts of the country, sometimes there's estimates that the Lyme bacteria can be as high as 50% in those ticks. So why aren't we seeing lots of true Lyme disease? Well, it's because it's thought that it takes a while for the disease to get from the tick to the host. that it actually takes on average more than a couple days of the tick feeding for it to get from the tick to the host. And of course, there's people who have data that suggests that it can happen at much lower time periods, like even within a day, but that would be the minority of cases. All right. But still wear long pants when hiking or doing landscaping, LOL. Yes, I agree with that, Empire City Ray. Yeah, I'm glad that you found that helpful. And the whole Lyme issue, I don't know how many of you guys have heard me talk about it before. And I'll just answer yes. Easy answer. You have different parties with different opinions on it and looking at different sets of data or looking at the same data differently. And the one group you have is infectious disease specialists. These are internal medicine specialists who have then gone on to do a fellowship in infectious disease. And these are the people who study infectious disease, including Lyme. And they are of one opinion. And then you have another group that's made up mostly of, I'd say probably mostly primary care physicians, although I can't say for sure, who say, nope, the infectious disease people got it all wrong on this issue. They have some kind of vested interest in the medical industrial complex. Maybe the military and the government are involved too. And they're not correctly interpreting the data when it comes to how common people are actually suffering from long-term complications of Lyme disease or long-term infections of Lyme disease. It's a bit of a controversial subject. I tend to, because I look at the data and I see two different parties presenting their own information that is just absolutely counter to each other. And I just don't have the time on every subject to read the actual original articles and to critically look at the study methods. So I have to pick somebody to trust in that case. And the party I've chosen to trust is the infectious disease specialists on this one. And trust that their evaluation of the literature of their field that they are trained in and do all the time is the correct interpretation. That is that the Lyme disease argument for chronic Lyme disease is that there are symptoms that can continue after somebody has Lyme disease. It's not necessarily an active infection continuing, and the treatments that are used for it, the long-term use of IV antibiotics in these sessions over time, the treatment with that is not different from a placebo, which is ongoing episodes of pain that come and go and gradually get better over time. So that seems to be what the treatment produces. According to the studies, that's what a placebo produces, or even people who aren't getting treatment. So best overall medical journal in your opinion, I'm not going to give you a name. Medicine has different journals for different specialties, different journals for even in general medicine, looking at slightly different topics from different places. For example, the AMA has their own journal, Journal of American Medical Association, which will have articles on various topics. Some other general journals would include such as the New England Journal of Medicine from Massachusetts Medical Society. You also have Lancet from England or British Medical Journal. These are all fairly general journals in medicine that are highly recognized and respected. When we talk about journals, a term you often hear is peer-reviewed. Peer-reviewed meaning there is a committee of doctors who looks at any submissions to that journal and checks it out and sees that, yes, this is indeed legitimate and the results can be applied. We have specialty journals like in emergency medicine. There is the, I'm trying to remember the name. Annals of Emergency Medicine. Is one that's used quite often in emergency medicine. There's also one for academic emergency medicine. I can't quite remember the name. It's from the Society of Academic Emergency Medicine, or SAEM. And those are kind of two major journals in emergency medicine. Family medicine, of course, has American Academy of Family Practice, their journal, Family Physician. Keratinaceous cross-linking, and don't know what that question means. And of course, I'm trying to address your questions. Lots of people join us this evening. I don't know, maybe this is a better time to do it than the lunch hour. If you're not already following, swipe right to follow and share with your friends who have an interest in medical topics. And Pamela Bailey, hey, that is awesome. Where are you? I'm in Auburn. Oh, you're in the Reno area. Okay. I am actually looking toward Reno now, as you can probably see on those little maps they have on Periscope. That is a killer shirt and tie. Empire City Ray, you are a man after my own heart. How did the girls' birthday party go? It was a great, successful party. They spent like the whole morning cleaning up the place that we rented for it the next day, which, as you can see, was kind of a really nice place. And all the kids were quiet at 10 o'clock like they're supposed to be, and they all left shortly after. It was a success as far as a parent is concerned. I think the kids liked it too. Have I had dinner? And what did you have? I have not had dinner. I am still waiting for my wife to pick me up, and then we can go home because I stayed late taking care of a lot of stuff because Dr. Gwaine is out for the week and I have to cover for him, and I'm realizing, wow, we are really busy these days, and we need to get a nurse practitioner to help out. Lots of hearts there. Thank you, guys. Appreciate that. What's a good practice to prevent boils from cycling long ride? Well, there are concerns if you have a habit of getting boils with your long cycling rides. The concern is that you may have a virulent bacteria on your skin that needs to go away. And so if you have this problem of seemingly always having one of these lesions, your doctor may want to take a look at it and possibly culture one, possibly treat with some medicine. All right. What exactly is a nurse practitioner? A nurse practitioner is somebody we call an advanced practice nurse or a mid-level medical service provider. They kind of work as a physician in that they can diagnose illness and prescribe treatment, although they are not truly a physician. They're not licensed by the same board, but they go through a lot less training to be able to actually practice, to a certain extent, a limited practice of medicine. Not too different from physician assistants who also do the same thing. They practice medicine, not to be confused with a medical assistant, which is an assistant in the office. A physician assistant is actually somebody who sees patients primarily and prescribes treatment under a physician's supervision. Oftentimes you have a physician also supervising the nurse practitioner, although in California a nurse practitioner can see patients without a physician being in the building supervising them, whereas a PA should have a physician in the building supervising. That's the difference. And that's why we would tend to lean towards a nurse practitioner in the position we have here, so it's somebody who wouldn't have to have a doctor in the office every time that they are working. So if you guys know any good nurse practitioners, give them my number. Okay, what is my favorite book? The Bible. And that is for Chief Executive Mind. And there's some good books behind me too. Look at that. Can I zoom in on any of those? Let's see what we have sitting in the shelf there. We have, oh, can I not move it? There we go. We have an emergency medicine text, an internal medicine text in 2 volumes, a medical dictionary, which I actually never use because you have that online now. And then we also have emergency medicine procedures by Roberts and Hedges, Lang, just a medical text there. And then Joseph Sapira's The Art and Science of Bedside Diagnosis. I think that's the title of it. I'll have to go look. And let's see here. You like him too? Who? Joseph Sapira? Do you know Sapira? Let me look at that. Is that in, let me see. Is that The Art and Science of Bedside Diagnosis? Yes, that is the title of that book. Very interesting book for you. Yes, yes, yes. Pamela Daly likes that answer too. And then, of course, above my books, we have, I'm trying to remember the name of this particular anatomic model. They all have names. It was Pull Apart Patty in 7th grade. This one, I believe, is it Victor or Victoria or something like that? It depends on which parts are in. With the internet, have hard books become unnecessary? Oh, that depends on who you ask. I could live without the hardback books and just having an online library myself. I would be okay with that. In fact, with us needing room to get another person in this tight little office, that bookshelf is probably what's going to go, because it's very rare that I pick up a book. I'm usually getting on my library online. The problem is with the online library, though, you have to pay subscriptions to keep having access to medical books. Did I get your question, Empire City Ray? I've had questions from you before. Oh, a neck fusion. I am so sorry. Oh, man. Hopefully this one will be good. Let's just count on that being the case, because the mental attitude is a big part of how you do with medical procedures. On a desert island, what 5 medical supplies would you choose? Oh, what 5 medical supplies? Let's think about that. What would be the most important medical supplies? I wonder if I would choose some way of being able to clean my hands or sanitize them, maybe like an antibacterial cream of some sort. What else would be important? You're probably going to want a scalpel so you can do anything. Another one of my favorite medical instruments is the really, really small pointed forceps, tweezers with just tiny little points. Those are quite useful. Surgical sanitizing machine. Oh, we have power to sanitize things, but I would want to be able to just do my hands with just some antibacterial, what do you call it? Purell. What do you call Purell? Purell is a hand sanitizer. There we go. We'll just call it hand sanitizer. Yes, the little forceps, the needle nose tweezer type of the instrument. That's a very valuable one. So something you can cut with, something you can grab things with, things that are hard to grab. So that would be like the very small forceps. Hand sanitizer, that'd be 3 things. Maybe some kind of endoscope, a scope that you can put into body parts to look around, like a nasopharyngoscope, which may be able to, in a pinch, double as a type of colonoscope or sigmoidoscope, although those you can pump air in to open things up. Gauze, if I was on the desert island, I would probably forego the gauze and just use leaves. Because the gauze would run out, and that would allow me to have some other instrument. Okay, I try to drink 4 to 5 glasses of water a day. Does it matter how much water you drink? It does matter how much water you drink. You want to drink enough. How do you know how much is enough? When your urine no longer has color to it. That's how you know. And that's a different amount every day. On a day that's very hot and you're real active, you're going to need more water than a day that's not that way. So it's going to be a completely different. In fact, your requirement for water can double from one day to another depending on physical activity and ambient temperature. So it's not at all a specific quantity or number of glasses of water. It's how much it takes to do the job, and you can tell that by looking at the color of your urine. So it looks like Pamela D. Bailey can keep her urine clear with 8 to 10 glasses of water. Very good. Empire City Ray says, my friend in Florida got hives, 2nd day. She was given estrogen for an OBGYN issue. Any correlation? Possibly. Next question. Lots of hearts. Those are awesome hearts, by the way. And good turnout tonight. I'm glad that you guys are enjoying this. Maybe this is just a better time to do it, even though we don't usually do it. Oh, by the way, I am on call for 2 doctors. So if all of a sudden the Periscope stops, everybody just assume I got a phone call. And that would be the explanation. You probably won't be back again tonight. Drink plenty of water every day, but urine has a strong odor. Is that normal? Well, are you eating a lot of asparagus? Do you have a urinary tract infection? Thanks so much. Oh, you are so welcome. And Pamela, oh, okay. So this is a time that works. I am often surprised at Holly and Danielle. Yes, you two surprise me. The reason you surprise me is that it seems like no matter what time of day I'm doing this, you guys are there, which is wonderful. I love that. But I do wonder about your life. I hope it's full of fulfilling relationships with others and satisfaction with your work. Such a doc giving your number away. Oh, I didn't give my number. just the on-call number. And Chief Executive Officer likes this time more. Hey, from Washington State. What? Greetings from California. Empire City Ray, yes, it is available to the patients, and surprisingly, rarely do they do anything that would even border on considering it an abuse of the access. They save it for actual things that need to be addressed outside of regular office hours. So I really appreciate, if any of my patients are out there, thank you for respecting the time after office hours, because we can take care of things during the office hours that can be taken care of then. If they can't, we take care of it. And there's so few calls and such little need of it because we take really good care of patients here. We have a great system for keeping things taken care of. LASIK, yes, I recommend it for the people that it's good for, which isn't everybody. And am I close to Apple Hill? let me look out the window. I would not be able to see the Apple Hill area from here, but there are some areas around here where you can look up that direction. We found that out when there was a fire out that direction not last year, maybe it was 2 years ago. And we were able to get up on the ridge and look out across the canyon and pretty much see, oh, that's where Apple Hill would be. Okay, guys, this has been an awesome session. Thank you for joining us. Until next time, this is Dr. Vaughan telling you to stay in good health.